medication has its place for seizures, for headaches, for sleep, for severe emotional dysregulation, and when medication needs to help a symptom. But if we can help retrain the problem, then the symptoms will get better.
Hello, everyone. It's time for another episode of the Ramos Law Difference Makers podcast, where I, your host, Dr. Jim Hoven, have a chance to meet with amazing people making a difference in the lives of others every single day. Sometimes it's locally here in our town, sometimes it's across the globe. And today I have someone who is incredibly gifted and incredibly talented. And while she and I just met for the first time just a few moments before the show started, I can tell you her energy, her vibe, the goodness that she exudes is something that you are going to feel whether you're listening to this or watching it. So sit down, relax, and you're going to start learning about traumatic brain injury, neurological injury from a very unique perspective, and that of a physical therapy perspective, an energy perspective. And that's something we've not talked about before, even though we've talked about head injury, concussion. We've talked about that several times on the show. This is going to be a unique slant, and you're going to love it. So again, be prepared to take notes, be prepared to share this, and just sit back and enjoy. And so right now, it is my pleasure to welcome to the show Miss Mary Pavlantos. Mary,
Thank
welcome.
you.
And it's Dr. Mary, by the way.
Yes. Well,
gosh.
Doctor of physical therapy, like not a real doctor, but I went to school for a few years.
You're a real doctor in my mind.
Okay,
so, Mary, first, I think it's important that people know how you got into this, because I know for when I was starting my chiropractic career, the way that it got started was I got hurt playing football, hurt my neck, and caused all these problems. And they say that many healers are wounded healers, something that has touched their lives. Is that the case with you? And if so, would you share that story with us?
Yeah, absolutely. So a few things happened that led me to be a healer. But originally, my dad was T-boned when I was in high school. It was a snowy road, and someone couldn't stop going like 45 miles an hour and T-boned him, and he rolled 4 times. And he got a traumatic brain injury, broken neck, all of his MRIs were fine, his glioblastoma was fine, like everything in the hospital checked out, but he had these broken bones, and discharged home, and that was about that. But it really severely affected his memory. He couldn't remember anyone except for our family. He couldn't remember people at church. He couldn't remember the community, and he was a 30-year business owner of a restaurant. And so he couldn't run the business. My mom tried to run the business, and we lost our business, lost our house from this accident.
Wow.
Yeah.
Literally, it upset the lives. The ripple effect was monstrous.
Yeah, we didn't know why Dad was so tired and why he had headaches, and because his broken bones healed, and the neck collar came off, and he looked fine. So this is what we call this invisible injury. With a lot of neurologic conditions, people don't understand how it's affecting someone. So I went to school to play college basketball, and I was gonna pursue physical therapy, but not because my dad was. So essentially, I was left to go on my own at 18 because we lost everything. But I was like, I think I'm good enough to play basketball somewhere. So I went to Whittier College in California, and I played basketball, and I blew my knee out. And then I got to do physical therapy for my ACL repair. And I was like, oh, this is cool. Help people get back on their feet. And then I was like, oh, physical therapists help people with brain injuries. He essentially was trying to work whatever job he could, which is very common, is people are trying to support their family, or they're trying to do whatever they can for their family. Especially he was the breadwinner, and he was just working whatever jobs he could find. And he was selling cars, and he fell and hit his head. He slipped on ice and hit his head. And the brain MRI showed an old diffuse axonal injury, which was an old injury. And they're like, oh, he has this old brain injury. Do you guys know about that?
And we're along the way,
this is 3 years later.
Yeah, no one was thinking about that, even though all of the change in symptoms, it just didn't occur to his treatment team that there was
no treatment team, really. There was not good legal or medical guidance. And it was a decent case that got settled too quickly, and just, you know what I mean? So yeah, he just got all the wrong care, essentially. Right. And so then after that, then he started getting care. He started going to speech therapists. He started getting PT 2.5 years later, which is common. I still see this to this day. And then I'm like, oh, I definitely have to help people with brain injuries. Like, so I did. And I went to grad school in Philadelphia where I got my doctorate and like did all my extra residencies I could in traumatic brain injury. I worked at Craig Hospital, which is like one of the best
world-class facility.
Yeah, brain and spinal cord. But it was hard because these people are vegetative. These people are severe complete quadriplegics, and like as an empath who like feels other people's energy, it's just like it's really hard and it's sad to see people that hurt, but also super fun to like help people walk again for the first time and see them smile for the first time because their frontal lobe of their brain's affected and they don't feel those emotions, and then it heals because there's this amazing neuroplasticity of our brain to be able to heal, right? And so that kind of guided me in my path, and I was in rehab for a little while, and then I kind of moved to outpatient. And when I went from rehab, was like helping people with stroke, spinal cord injury, brain injury, like walk again. And then I wanted to just be closer to home, be closer to my daughter and my family. And I just noticed I had like no neurologic patients, but all of my motor vehicle whiplash patients coming in with their sunglasses and their hat, and they can't fill out the paperwork. And so I was just noticing like, oh my God, these people are all really concussed. They have mild traumatic brain injuries. And like, so we need to retrain the visual system. So I'm a vestibular therapist. We retrain the eyes, the balance, help with the pain, but kind of get the systems working together again. And so then like kind of just stuck with outpatient, and that's what I do now. So I've done this for 15 years and I have my own practice, and that's what I do. I help people like that, you know, they're done with their surgeries, they're not in the hospital anymore, they can drive or someone can drive them to therapy to like help heal.
And you know what's really interesting to me about what you've shared from your story so far, Dr. Mary, is that it's fascinating because people don't think of physical therapists as specialists for treating internal injuries like a brain injury, like you say, this invisible injury. They think that more of neurologists and other kinds of specialists. And so I know that you have a certification in this, like, and it's not just a PT certification, it's a certification that goes healthcare system wide, whether it be for neurologists, MDs, chiros, DOs, whatever. Yeah. Can you just explain a little bit about that? Because I want to set the stage here that as we move on talking about this, that you're uniquely qualified to have an understanding from a global perspective on the importance of getting good care.
Right, absolutely. So I have a certified brain injury specialist. CBIS is a training. You had to have enough training and experience working with the population and like take a test and submit an application and take continuing education through the Brain Injury Association of America. You don't have to have that to treat this population, but I've just put all of my energy and my time researching and studying and like figuring out how these people need to heal. And it always takes a team with like a good doctor and usually a cognitive therapist and a mental health therapist to help with the PTSD and like a PT to help with the physical stuff. And some in chiro, like everybody has their roles when helping these people heal. But the neurologic category falls like with MS, Parkinson's, like stroke, tumor, anything that can affect the brain, because essentially your brain just has like a traffic jam, I explain usually, and like you're trying to find your way around the traffic jam. One of my most successful patients was hit on foot and was in a coma, I think, for 3 months, like 9 years before I saw her. Okay, so she made a full recovery, got out of her coma, learned to walk again. She could drive, but she came in and she's like, Dr. Mary, I can't use my hand to brush my teeth. I can't write, and my foot's all funky, and I can't walk well. And so I use a lot of neurologic dry needling and just my knowledge of how to retrain the signaling with different exercises and stuff. And like 2 or 3 sessions, she's like, oh my God, I can brush my teeth again. I can't believe I can do these things. Everybody told me it was just as good as it was going to get. So anytime someone comes in, I don't care how long it's been, I always have hope that I can help them heal whatever way that looks like, depending on what's going on.
And how do people know if they have one of these? And we can keep it to either more brain and TBI type stuff, or we can expand it out into some of these other neurological things that now you've introduced. What are some symptoms of a neurologic disorder, starting with a TBI after a trauma, what might someone notice that they're like, this just doesn't seem right for me, or one of their support system notices about them?
Headaches, dizziness, double vision, blurry vision, ringing in the ears, balance changes, memory, personality changes, word finding. Pretty much our brain's like our computer network that controls everything about us, how we think, how we speak, how we move. So how we feel, people just get labile, or they have emotions, or they're just like crying all the time and they don't know why. So like any of the brain systems can be affected. So, you know, with Parkinson's and MS is like one of my favorite things to treat, because a lot of people get that diagnosis and they're like, well, I'm just going to end up in a wheelchair and die. But like most of my patients I've worked with are better than they were 9 years ago that I've worked with them, because they just had to exercise. They had to work on their balance. They had to get stronger. They had to stretch. They have to like do the things they need to like keep their body going, even though you can adapt. Like you either have to adapt sometimes, or you got to remediate, or you got to try to heal it. And sometimes you got to do both. Like if your memory's not working, you got to write things down, or you need to use a calendar, or you want to, you know, I can't remember your name, I'm going to repeat it and practice it. So,
So one thing that's really interesting to me is there are so many techniques, there are so many ways to stimulate the nervous system. We can stimulate the nervous system, as you've mentioned, through movement, right? Movement stimulates the brain to have to figure out information and respond. There's also things with medication that stimulate. There's nutrition that stimulates. In your context of how you do what you do with a neurological, whether it be a head trauma or one of these other things that a neurological condition someone may be diagnosed with, what are some of the fundamental pieces? Like, for example, what movements might someone go, and they might be too individual for you to,
I can't answer this question.
You know what I'm saying? Just general class, so that people could get a handle on. It's just that simple. Like that kind of simple movement can make such an impact on the brain.
Right. So it is grounding, and that's why I named my business Roots Physical Therapy and Wellness, with a big tree with a person wrapped in it. Because when someone has a really bad car accident, you go into sympathetic overdrive, fight or flight. Like you're not in control of yourself, right? And there's also not only sometimes a brain injury, multiple bodily injuries, but now we also have some PTSD and some other things going on. So I'll have people come to me and they're like, I don't know what you can do, because I've been to so many other doctors and everybody says I'm broken forever. But like they just haven't even grounded. So I just step back and give people tools. I have them try to like close their eyes, lay on the ground, feel the earth, like ground the vestibular system, work on breathing and positive self-talk. Like, so I give everybody breathing stickers and I tell them like, put one on the doorknob, put one on your phone. And like, every time you see it, take 3 deep breaths. And like, I'm safe in this moment. Everything's okay. Put one in your car every time you get triggered because you're worried about getting rear-ended again. And just tell yourself like, I'm healing. I'm doing all the things I knew to get better, and just positive reinforcement, grounding. And I think that's the biggest part that's missing. Absolutely, medicine is necessary for some patients, and they need to sleep. They need to have, medication to help them with their healing. And it can be really, really helpful. But sometimes just having people like meditate, because some people have those tools, they forget to use them, or some people have no idea what that means.
Yeah, and they don't connect it to healing, right? They think meditation to a spiritual practice of spiritual growth or something, not towards healing. And there's plenty of research about how the mind and our self-talk actually drive our bodies. And we know then the research that deep breathing decreases heart rate, decreases blood pressure. So it's just also giving the patient the control back of themselves, because something else took that away from them, right? And so it's trying to get people to be in the present and be in the now and figure out how to be this person again, that they just, nothing seems right about their person. You know what I mean? And everybody's saying all these things about them, and no one's supporting them, and nobody understands. So I love bringing families in as quick as possible, kids in, this is what's going on. And I put it in layman's terms, how can you support your parent or sometimes it's a kid. And especially there's a lot of behavior changes, and there's anger, and there's outbursts, and people aren't acting like themselves.
it's just because their frontal regulation's off of their brain.
Can you share maybe a couple of things of how the family members or the support team can support them?
Yeah.
Obviously, patience is going to be one thing of acknowledging and understanding these outbursts aren't truly them. This is a reaction that they really can't control. But are there other tips or tricks that you've been able to share?
Yeah, I mean, depending on how bad like memory is affected, having people like make sure they keep a calendar, or there's like if say there's a married couple with kids, like if this is a full-time working mom and she also does everything for the house, like the kids are teenagers, like you guys need to help mom. You need to do your laundry. You need to clean the dishes. Like your mom can't do these extra things right now. Like her body's using extra energy to heal. Or whatever it is, wherever someone maybe be able to like pick up a little bit of the load, just taking off those little things so that someone's like, okay, I don't have to worry about that because I, have a severe headache and I just barely got through the workday. So any ways that family members can help. For my dad, he couldn't make coffee. So he couldn't process, this is like executive functioning of the front part of the brain. Like he couldn't figure out how to make coffee. So we wrote like a list. We just figured this out. I don't know. Like, Dad, these are the steps to make coffee. And like, he couldn't get dressed. He like would forget to put a sock on. And so he just had significant like issues with that. So we wrote a lot of sticky note reminders to help him. Like he didn't need physical assistance doing it. Someone with a severe enough brain injury might not be able to use like one side of their body and like needs physical assistance, right? So just any way that you can understand that this is not their fault and they're not trying to be this way, and understand this is a side effect of this injury, and don't take it personal, right? So. And
how long do typical treatment programs, obviously understanding the severity of this, because it goes from mild to very, very significant.
Absolutely.
But if someone starts undergoing, I think the main theme here is if someone's experiencing that, they need quality care, people that know what they're doing, that have dealt with this before. But assuming they find that team, what can they expect in results? Is it something that by giving them these lists you talked about, by getting learning some of the tools of breathing and grounding, and then getting help with their emotion and talking with people who are skilled, is this something that we can see changes in weeks, or does it take months or years?
Oh, no. I mean, absolutely weeks, definitely not days sometimes. But I have a patient I started treating in May, and he got rear-ended. He was unconscious. He was hospitalized for a day. He had a severe bleed. Like he actually had a bleed show up and like stitches and like multiple bodily injuries. And I think I saw him within a month after his accident. This is in May, and he's a school teacher for special education kids. He returned to school. He is full-time teacher with some brain breaks and some modifications, but he had medical, he had PT, he had cognitive, he had emotional, and I gave him everything I'm telling you. And that's a really good example, is like the sooner we can get this treated, the faster these people get their lives back.
Yes, because you'd mentioned, and I think it's almost a godsend that people can get help 9 years after, like you've experienced, but the sooner the better, right?
Absolutely. When someone has such a severe injury, they're like medically comatose, or they need to learn how to walk again, and then they go to rehab, and then they go to outpatient for 3 months, and they're like, okay, well, that's about as good as it's going to get. So that's, I think, where there's like a disconnect, is sometimes people, like, you can still be healing for years with the right tools. You know what I mean? So it's been so wonderful, like, help people that are like 10 years ago or whatever, just get out of, my other probably best success story, a gentleman was like playing catch with his son, and he was running backwards, and he stepped in a pothole and fell over and ended up having like a full craniotomy, brain surgery with a brain bleed, just because he stepped in this pothole and hit his head too hard. And when he came to me 10 years later, he had already lost his house, lost his job, but he somehow was able to go back to work because he was that good at what he did, but he was using all of his energy like on the computer. And he couldn't, like, he had sunglasses on, he couldn't drive, he couldn't walk backwards, his balance was terrible, he was like in so much physical pain and on a lot of medications. And we just peeled away the layers of the onion, and he's actually training for like a ridiculously long 14-hour open ocean swim.
Wow.
And his balance is fine and he can drive. His eyes aren't quite right. We didn't quite get to like fully fixing the eyes because the eyes can be really affected. They're connected to the brain and they don't focus, they don't track right. But yeah, absolutely, like, got him his life back. It's been so fun to work with these people. It's just like everybody, you just have to listen, you know, and medication has its place for seizures, for headaches, for sleep, for severe emotional dysregulation, and when medication needs to help a symptom. But if we can help retrain the problem, then the symptoms will get better.
Yeah, because
right?
if we only look at the medication component,
Yes.
then we're never going to get the progress that we want of the tools that
Right,
someone can
right.
use or be given. But on the other side, that medication has its own set of issues, especially
Correct.
taken long term, right?
Sure.
Now we start getting complications from that. So I love that. And I think talking a moment about alternatives is a good idea because people might not have access to someone
Sure.
like you if they're listening to this in some
Yep.
small, real rural area.
Yeah, yeah,
so
yeah.
some of your tools have been great. I'll tell you one thing that really helped. One of our sons was in his college years. He was at a party at his house, and he had a roommate. And so they were all at this place. Well, the roommate was very antisocial. And so when the party was at his house, he got upset and don't know if he'd been drinking or what, but he ends up taking a full wine bottle and hitting our son in the head twice.
Oh.
Right? This thing's full. And then it led to a big problem where they both ended up in the emergency room. One from getting hit with the bottle and then him not going out causing damage to the other kid. And so they both end up in the hospital. Well, it turns out that our son was so impacted that his school, you know, all the teachers in his in his college, of course, said, okay, except one. And so he couldn't formulate a sentence. And of course, that created all kinds of problems. Well, one of the things that really helped him was hyperbaric oxygen therapy.
Yep.
And so those are the kind of things that I think maybe it'd be good for us to spend a moment on stuff like that to say, hey, listen, there is hope. There is ways. These are some of the latest things. Have you seen HBOT be effective for these kind of things?
For sure. I also have a daughter who's had 7 brain injuries.
Oh, wow.
And she's 11. And the first one happened when she was 4. And my son, who was 13 months, threw a glass vase that shattered on her head. Oh. And it affected her attention and her ability to read because she was just learning how to read in 2nd grade. And so, like, as a parent who is trained in this, but not trying to be like an overly paranoid brain doctor, like really has had to, you know, and then fell out of a hammock and she couldn't walk for a few hours and like just one thing after another, right? Of like being a parent. And I am so passionate about kids' concussions because you saw how it affected your son in his school. It absolutely, she's still on an IEP and her reading's slow and she gets some headaches and she gets a little overstimulated. She actually wrote a book and I would love to publish it, but I have not. I published it myself on Shutterfly, but it's called My Invisible Injury, A Story of Kid Concussions. And it's the only book written by a kid with concussions.
How old was she when that was written? She's 11 now,
7
right?
or 8. Yeah. And so, you know, and so like living through this with my daughter and trying to help her. And so alternative therapy is absolutely like doing concussion specialist, vestibular, vision therapy, cognitive therapy, like trying to rewire the brain. But alternative things, I also, where I work, we don't have hyperbaric oxygen, but we have Kristen, who was actually hit on foot by a drunk driver at 50 miles an hour with like 11 skull fractures and a severe brain bleed. She got her life and figured out how to heal herself because she didn't have the right tools where she lived to heal. And so she does Live O2. So this is like hyperperfusion oxygen therapy with elliptical. So lots of oxygen therapy can be helpful. Getting enough exercise, eating healthy, like cutting out inflammatory foods, gluten, dairy, sugar. Like a lot of people really need a really healthy diet to allow their system to heal and thrive.
Are there super nutrients that are good for brain healing?
Yeah, there's a lot of different
fish oils,
yes,
that kind of stuff.
The CoQ10, riboflavin. There's like quite a different variety of different supplements that people can take. I'm always like hesitant just because I don't know what other meds they're on, and like I'm like usually I have them talk to their doctor about supplements. for like headaches or whatever. But I mean, there's lots of alternative therapies. There's like brain stem cell, but there's like not a lot of research on it, and like it's really expensive. And so I try to have people don't do anything too expensive, because like some people are really financially hit by this. And just, I say, use the brain to heal the brain.
Yes.
Like, I always tap in when someone comes in. Do you believe in anything bigger than yourself? Like, do you believe in God? Do you believe in anything? Call it whatever you want. And sometimes the answer is no, so that's fine. But like, I just believe that there is an energy force that can help us heal, and that we have these amazing bodies and these amazing brains, and I've just seen them heal. Like, I gave you a few examples of these patients. And just use the brain to heal the brain. Like, ground yourself, and where there's a glitch in the system, it's like when it's sitting in traffic and you're like, okay, do I want to sit here for 2 more hours, or do I want to try to find a way around this traffic jam? And sometimes you sit and sometimes you go around, like find a way around the traffic jam. And just repeat to retrain, lose your balance to gain your balance. There's all these little clutch things I've picked up along the way or come up with that one of my patients is like, seriously, I have it on a wood thing that I wood carved in my room, in my therapy room. And like, he's like, you just got to tell everybody, just do that. Use the brain to heal the brain. And so like we do, because there's billions of neurons and they just get sheared or stretched. And oftentimes the MRIs are normal.
Yes.
Imaging is normal. And like, nothing's wrong. Well, clearly, basic neurologic testing with eye tracking and balance is not normal for your age. So like, something's wrong.
Yeah. So we start then, if someone were to be saying, I just don't feel right, I don't feel myself. And again, they might not have had a trauma that they even remember, like, because it happens as kids. I love that you brought up kids. It can happen on a schoolyard playground. It can happen on a football field, a soccer field, in a gymnastics area. It can happen slipping on the ice, snowboarding, a zillion ways for it to happen.
All the ways.
And it might not heal on its own. And so I think the things that you've highlighted about feeling, do you feel agitation, a sense of not being well, sleep issues, light issues, plus all the other lists of things you talked about, help people understand, wow, there could be something here, even if the brain MRI is normal and that kind of thing. And so I think saying that people need to, it would almost be good that if you've had any trauma in your life, you should focus on a program that starts with some of the tools that we've talked about already.
Absolutely.
And just see what happens. And then if you don't get better, then maybe see a specialist, maybe look at cleaning up your diet, all the basics that would help us with any condition regardless.
Right.
But here's something that I thought about as you were saying, use the brain to heal the brain. In working out, we all know that if you want to get better, you challenge yourself.
Right.
Like, you can't run the same pace, lift the same weight, do the same stretches, and expect to get farther if you don't challenge that. Is that the same in brain therapy when it comes to this, or do we got to stay really careful to go inside the challenge space? Yeah,
good question. Patient specific. I have this snow globe that I use in my room, and it has a brain in it. And I tell people when they do their therapies, you're going to shake the snow globe. And some people get dizzy, nauseous, headache. You can tell your system's working. And then I'm like, let it settle down before you go to the next exercise, right? So the exercises are trying to retrain like all the cranial nerves and all the nerves in the nervous system to get them where they're supposed to be, so then it's normal in life. But sometimes people are like, oh, those exercises you gave me, I just feel like I can see so much better. And so I do them and I feel better. And so I'm like, okay, great.
Do them.
Do them. So it's hard to say. I would say probably more often than not that people get symptomatic. Like, a lot of people don't like vestibular therapy, vision therapy. It's too much. And so and that's where treating patients like snowflakes, like, we're all different people. We have different personalities. We have different backgrounds. We have different traumatic pasts that can come resurface when you have a new trauma. And like, just listening, like being very careful. Like, I'm very careful even how I treat my patients. I use dry needling as a great tool for muscle tension, but sometimes I can't even touch a person. I'm not going to stick a needle in them. So it's just like listening and trying to listen to the system. And like I say, don't poke the bear. And everyone's like, I got the bear poked because I went to a restaurant with my family. And I'm like, well, did you use your earplugs and your hat and your sunglasses? So you have to use some tools in order to do life sometimes. But yeah, it's just like so specific to people as to like what you do to heal.
You know what's interesting about that? You talked about vestibular training, and I am certainly not a specialist in vestibular training, but I have done enough of it, especially with, people will get the crystals in the ears and then they get real crazy.
Yes.
I've worked with a lot of patients where you do the Epley's maneuver and you put them on their side and rotate, and they were good. Isn't it interesting that you mentioned your daughter and how you treat your daughter? My mom had this going on, and I was visiting her in Arizona, and so she goes, I have this dizziness and they haven't been able to figure it out, and I don't get to see my mom very often, so I'm like, okay, let's do this, let me check. Oh, it seems like that's the deal. So I put her through it and I sit her up, and then I go the other side, put her through it, sit her up, and it cleared, but not quite, so I kept doing it. I made her so much worse because I overstimulated, because I care so much, I love her so much. I'm like, I got to keep doing this until it's gone, because I'd seen it go so many times before. So I think that goes to what you're saying. Like, you got to know the balance of when is too much. And it sounds like for brain injury stuff, when you're going through your recovery or process, you have to pay attention to where you cross that line of, now I'm symptomatic. Let's let that calm down a little bit before we take another shot.
Right. I mean, in your defense, like, because I'm a vestibular specialist, sometimes it can be in like multiple canals in different ears, and it gets really tricky as to which position you put.
See, I don't have that level, so I probably messed her up.
No, maybe not. Maybe it wasn't even BPPV. So a lot of people come in with vertigo, and like positional vertigo is just like you roll over in bed and the whole room's spinning. You see it spinning, I see it spinning, and that can happen from head trauma or nothing. It just happens in the middle of the night, right? And so, like, in your defense, you were just trying to help your mom, but I love that we're sharing our life stories, because I think it truly shows that we're empathetic people. But I share that I almost died of COVID.
Really?
Yes, it was Delta 21, and it virally attacked my brain. So we're talking about brain injuries here coming from trauma.
Yes.
You can get traumatic from viruses, right? Like West Nile or what else? Like meningitis, right? And so it really attacked my brain. I fought for my life, and I didn't end up on a ventilator just because I had a lot of medical resources to help me come out of it. But it did affect a little bit of my memory and fatigue and word finding. And I just luckily had enough resources to know like what I need to do for myself to get better. And I had this knowledge as a brain doctor, like there to like fix myself.
So the same tools, the same tools. Use
Absolutely.
The brain to heal the brain through the same tools. Meditation,
and it was like a massive inflammatory process, right? So like I had to like do all the things to get the inflammation down, and like gluten is really inflammatory to my system, and so I just had to figure out like, okay, now I really, really can empathize for my patients, because I just had to go through this myself, and made me even like better practitioner, because like I know how you feel. I personally know how you feel.
Yes.
And I didn't have the dizziness and the headaches and the vision and the balance, but like it's all, sometimes people have all of that, and it's so hard. And that's like what my dad went through, and that's what so many people went through. So you just kind of heal one thing at a time, and like just use the body to like self-heal, so.
One thing that you mentioned was this concept of resources and people helping and lifting each other up. And especially in the case of trauma like your dad, where he was, in an accident, wasn't his fault, and it cost him everything that he had to build back up from. You had mentioned that, there was a legal case and it didn't go exactly as planned and that kind of thing. What role do you see now as a healer and a provider, a role that relationship between the patient and an attorney would play in this, where they can do some of the heavy lifting, they can take away some of the pain? Have you found in your experience that becomes a really key piece in the healing as well, where they have that ability to relax?
Yeah. When people have a really good attorney like this law firm that like they are supported and they're listened to, like I've heard you guys answer your phones and it's nothing but like positive and supportiveness, but like patients just get so stressed over the money and the situation, and I'm like, the attorneys that are checking in and they're letting them know what they need to do, and helping them like be there for them as they're healing seems to be the most effective thing. Some other attorneys just seem to like step back and not be involved at all. And it seems like patients want someone there in the legal aspect to like help them. Okay, where do I go? Or is there enough money for this? Or like, what is going on? Do I have a good case? Do I not have a good case? So like, it just gets another added stressful thing. Yeah. So the more the like supportive attorneys like help patients through the process, like this law firm, then the more like that's one less thing they're worrying about, because that's what your attorney's there to get the records. Your attorney's like helping you find resources that you need in the community or whatever. And just to let you know like what this looks like, because these people just driving to work one day or whatever, and like it wasn't their fault, and none of us expect to be in an accident. Like I've been in a 10-car pileup. Like I was just going to high school one day. Like nobody expects to be in an accident. Yeah. So you just control what you can control. So
thank you for that insight. I think that's really important. And I have one more question for you.
Sure.
And it comes in a completely different vein. Because of your great life experience, because of your training, because of the things that you've seen and what you do every day, is there a piece of advice that either you've learned, were given, or come across along the way that is now the central part of your fabric of how you go about life and do what you do that you'd be willing to share with us?
For me, it's my faith, because I believe in God, and I just believe that like we're never going to get more than we can handle, and don't give up no matter how hard it gets. Look at even if it's not God to you, just watch the sunrise, look at the birds, like find whatever peaceful things you can find around you to just know that like everything's going to be okay.
I love that. Mm-hmm. This has been amazing. This has been wonderful.
Perfect.
And
thank you for having me.
The information and the wisdom and the knowledge that you've shared, I know it's only scratching the surface. I know that it goes much deeper. And so if someone wanted to get a hold of you, if someone wanted to basically say, man, I want to meet Dr. Mary, or ask her questions, or how could I be a great therapist like her? And
sure.
What would be the best way for them to go about doing that?
Probably through my email, Roots PT and Wellness Co., like Colorado @gmail.com, or my phone number is 720-704-7401. Or they can go on my website, but usually like phone or email is best.
Nice. Yeah. Dr. Mary,
Thank you for having me.
This has been a complete joy for me, and I wish you well. Know that we are big supporters of you and your work and what you do here at Ramos Law, and we'll look forward to more conversations together.
Thank you for having me.
Absolutely. So there you have it. You've learned more about concussions. You've learned more about traumatic brain injury. You've learned more about the nervous system and all the things that we as individuals can do to control this. So now I hope you'll take the time to assimilate this information, apply it where you can, and share it with someone, because the more we do this together, the more we'll all continue to make a difference. Have a great day.